Hello students, continuing our screening of blood for infective material. In first class we have seen about ELISA and today we will see particle agglutination assay and rapid assay. So particle agglutination assay, so this is the test. It detects the presence of specific antigen or antibody in the specimen. So it may give the results in the form of agglutination of particles. So particles may be the latex or gelatin. So these particles are coated with specific antigen or antibodies. So for the detection of antigen, the particles are coated with antibody. For the detection of antibodies, particles are coated with antigen. So these particles will speed up the process of agglutination, and the test of particle agglutination can be done in microplates, microslides or in the test cars. And it is a semi-quantitative assay, so we can give the report in the form of 1 plus 2 plus in that way also. So moving to the one procedure, the general procedure of particle agglutination assay, which is done in microwells. Here the sample is diluted with the diluent provided with the kit, and also dilute the control specimens also. So after dilution, transfer them to the microwell, that is to the appropriate wells, the labeled well it is transferred. After the specimen, now add the coated particles like gelatin coated or latex coated particles containing antigen or antibodies added. Incubate at room temperature for 1 to 2 hours. So during this incubation, the antigen-antibody reaction will take place. The antigen present in the particle react with the antibody present in the serum. So results can be read by naked eye. Here we don't require any ELISA reader. So reported in the form of reactive or non-reactive. So how do you report as reactive? If the microwell shows scattered mat of agglutination of particles, then it is reported as reactive. If the wells shows compact button or in the form of ring at the bottom of the wells, it is reported as non-reactive. So here we can see the latex particle coated with the antigen, and these are the antibody present in the serum, and how the agglutination takes place. Particle agglutination test carried out in the microwells, and how is the reporting. So non-reactive will appear in the form of compact button or in the ring form, or in case of reactive it shows scattered mat of agglutination. So that's about the particle agglutination assay. Moving to the merits and demerits of particle agglutination assay. So merits, that is the advantages are, it is a low cost technique. Here we don't require any instruments, and the procedure is simple and results are obtained within the short period. Results can be read visually, that is without the use of any reader, and involves minimum steps. So these are the merits of particle agglutination test. Moving to the demerits or disadvantage. Here, while reporting of wells to whether it is reactive or non-reactive, that to be done carefully, and subjective error in weak reaction. That means in case of weak reaction, or if the results are showing weak agglutination, the reporting may vary from person to person. So that is subjective error in weak reaction. Frozen reaction at times. That means there may be frozen reaction at times, that is false negative reporting may occur when there are more concentration of antibodies present in the serum. So when the antibody titer is high in the serum, so frozen reaction may take place. So you may report it as false negative. False positive reaction may happen when the antibodies are directed against the carrier particle than the antigen present in the particles. So these are the demerits. Moving to the rapid assays. So rapid assays you all have observed in micro lab and having blood bank also. So these type of tests using the kits, the strips. These are the tests which are rapid, and we use a single disposable device here, and the results are obtained within few minutes. So this method may detect antibodies or it may detect antigens also. Examples like anti-HIV, anti-HCV antibodies can be detected, and antigens like hepatitis B surface antigen also detected. Moving to the examples of rapid assay. So one example I have given here. So example of tri-dot assay here. So tri-dot assay for HIV. For the detection of HIV antibodies, HIV antigens are coated or deposited in the kit itself. Okay. So in the tri-dot we have the kit now. So in that the antigens are immobilized in a porous membrane. So over that add 3 drops of buffer solution, and after that the patient sample. So patient sample, if it contains antibodies, it will bind to the antigen present in the membrane of the kit. Then add buffer solution, then add conjugate, again the buffer solution. So buffer solution before adding the specimen, after adding the specimen, and after adding the conjugate. So finally the results are read visually. So I have given the example of a tri-dot test here. So tri-dot method we can see how a non-reactive HIV test will appear. And in case of HIV-1 infection, how are the 2 dots will appear? In case of HIV-2 infection, how the 2 dots will appear? And in case of both HIV-1 and HIV-2, how it will appear? And in case of invalid, without the control, how it will appear? So it is for HCV, yellow color, HCV tri-dot, and here we have the HBsAg for the detection of hepatitis B surface antigen. So how it will appear in case of positive and how it will be in case of negative. So for testing hepatitis B surface antigen, we have the membrane here, and adding the serum, adding the buffer, incubation, and the result. So what are the merits of rapid assays? So for rapid assay we have the advantage here. We don't require any expensive requirements here, any instruments, and the procedure is simple and rapid. We will get the results within less than 10 minutes, and we can read visually without the use of any instrument. And the HIV tri-dot, it differentiates from HIV-1 infection from HIV-2 infection, and the sensitivity is comparable to ELISA. We can compare the result of ELISA with the tri-dot or this rapid assays also. It is ideal for small blood centers. Moving to the demerits, it is costlier. False positive results may be obtained because of precipitation or presence of particles in the specimens. It is not ideal for screening large or many samples because ELISA using in one microclid we can do it for many specimens, but here for a single specimen we have to use individual kits. So these are the merits and demerits of rapid assays. So after all the ELISA, particle agglutination assays and rapid assay, so we have a small topic about what are the safety precautions to be followed for the personnel or the technologists whoever working with HIV or hepatitis testing. So always you all know Universal precaution must be practiced. So universal precautions include what and all, using the aprons, gloves, hand washing, all those. So we'll see one by one. So first thing is all specimen must be treated as infectious, use of disposable gloves, use of lab coats whenever we enter the laboratory, avoid mouth pipetting and also avoid eating, drinking and smoking in the work area. What the cuts or wounds present in the hands must be covered. Thorough hand washing is important before leaving the lab, and also use sterile glass plates while working, and before disposal of any lab material it must be decontaminated by the method of incineration or autoclaving. Working table lab equipment must be cleaned with disinfectant daily. Whatever spills must be immediately decontaminated with disinfectants. So what and all are the disinfectants? We have many examples here. So disinfectants include sodium hypochlorite concentration 10%, calcium hypochlorite 7 gram per liter, ethyl alcohol 70%, isopropyl alcohol 70%, methylated spirit 70%, hydrogen peroxide 6% and butyraldehyde 2%. So these are the few examples of disinfectants. So these are the few measures to be taken while working with HIV or hepatitis specimen. Thank you.